Welcome to this in-depth video on the Dobutamine stress test, a critical diagnostic tool used to evaluate heart function and detect coronary artery disease, CAD. This test is particularly useful for patients who cannot undergo traditional exercise stress testing due to physical limitations or other health conditions. Let's start with an overview of the Dobutamine stress test. Dobutamine is a medication that mimics the effects of exercise by stimulating the heart, increasing heart rate, and making the heart contract more forcefully. Unlike traditional stress tests, the stress is induced chemically rather than through physical exertion. Here's how the test is performed. First, the patient is prepared by fasting for a few hours beforehand, and electrodes are placed on the chest to monitor the heart's electrical activity through an ECG. An intravenous, 4, line is inserted to administer the dobutamine. Initial heart rate, blood pressure, and echocardiographic images are taken at rest to establish a baseline. During the dobutamine infusion, the drug is administered through the 4 at gradually increasing doses to simulate the effects of exercise. This increases the heart rate and the strength of the heart's contractions, thereby raising the heart's oxygen demand. Throughout the test, the patient's heart rate, blood pressure, and ECG are continuously monitored. Echocardiographic images are taken at various stages of the infusion to assess the heart's function under stress. The test continues until the patient reaches a predetermined target heart rate, typically 85% of the maximum predicted heart rate for their age, or until symptoms develop that necessitate stopping the test, such as chest pain, significant changes in the ECG, or a dangerous drop in blood pressure. After the dobutamine infusion is stopped, the patient is monitored until their heart rate and blood pressure return to baseline levels. Now, let's discuss the primary indications for the dobutamine stress test. It is often used for the diagnosis of coronary artery disease to identify areas of the heart muscle that do not receive adequate blood flow under stress, indicating significant coronary artery blockages. The test also evaluates cardiac function by assessing the heart's pumping ability and detecting wall motion abnormalities that may not be apparent at rest. Additionally, it's used in preoperative evaluations for patients at risk of cardiac complications during surgery who cannot perform an exercise stress test, and for assessing how heart valve dysfunction affects the heart under stress. Interpreting the results is key to understanding what the test reveals. A normal response shows no significant changes in the heart's wall motion or function under stress, indicating adequate blood flow, even when the heart is working harder. An abnormal response, however, may reveal new wall motion abnormalities or worsening of existing ones during dobutamine infusion, suggesting ischemia or inadequate blood supply to a portion of the heart muscle, likely due to CAD. While the dobutamine stress test is generally safe, it does carry some risks, particularly in patients with severe heart conditions. Potential risks include arrhythmias, chest pain, heart attack, and a significant drop in blood pressure. It's also important to note that the test is contraindicated in patients with certain conditions, such as unstable angina, recent myocardial infarction, severe aortic stenosis, uncontrolled high blood pressure, or severe arrhythmias. In summary, the dobutamine stress test is a valuable diagnostic tool for assessing cardiac function and identifying coronary artery disease, especially in patients who are unable to perform a traditional exercise stress test. It provides critical information that helps guide treatment decisions and the management of various heart conditions. Thank you for watching. If you believe the dobutamine stress test might be appropriate for you, or if you have any concerns about your heart health, please consult your healthcare provider.